This is the Celiac Project, two guys talking gluten-free. Just wanted to give a little disclaimer. We are not medical experts, doctors, dietitians,
Nurses,
bone experts, surgeons.
we're only experts at being celiac patients.
So enjoy the show. And if you're going to do any changes to your diet or need real medical advice, please go to the medical professionals.
That's what they're there for. We have an amazing treat for you. If you want to listen and watch this week's episode, you can go to youtube.com/@celiacproject and watch it there.
If you prefer, you can listen as you usually do. We hope to have some of our future shows on video as they are available, so look for that as well. Now let's get to the show.
Sounds good.
Today's episode of the Celiac Project podcast is sponsored by Taste Republic, who believes everyone deserves to eat good, fresh pasta, no matter their dietary restrictions. All of Taste Republic's pastas are certified gluten-free and beloved for not sacrificing taste or texture. With fan favorites such as 4-cheese tortelloni and cauliflower linguine, Taste Republic has a wide range of pastas to choose from. Find Taste Republic at retailers such as Whole Foods Market, Publix, Sprouts, Meijer, H-E-B, or online at tasterepublic.com. The Celiac Project podcast is proud to be partnered with Bull & Company MediaWorks, specialists in website design and digital marketing with over 20 years of experience. Go to bullcm.com to find out about all of their services. You found the Celiac Project podcast, two guys talking gluten-free. I'm Mike.
And I'm Cam.
And who's joining us on the podcast today, Cam?
Today we have Ann Moon and Dr. Annemarie Rompca.
They are both at Seattle Children's Celiac Disease Program. We get into some of the great things going on there. Let's get to the show.
Sounds good.
Cam and I are so excited to be joined today by Ann Moon and Dr. Annemarie Rompca of Seattle Children's. How are you both doing today?
Great. Thank you so much for having us. Yeah, thank you.
Really excited to have you on the podcast today. I want you both to do an intro. I'm going to start with you, Dr. Rompca, because this is your first time on our podcast. So can you tell everyone, our listeners, a little bit about yourself and the work you do at Seattle Children's?
Yeah, absolutely. Thank you again for having us. And it's my first podcast ever, so this is very exciting. So I did all of my medical training, residency fellowship in the Midwest, and then moved to Seattle about a year and a half ago to start as faculty at Seattle Children's, but most specifically to work in our celiac disease program with Dr. Lee here with all the wonderful things that they're doing. So I spend most of my time doing clinical work and am also the associate director of our celiac disease program as well.
Excellent. And listeners will know Ann Moon, you've joined us before. You've actually been on with Dr. Lee in the past and on your own. And why don't you remind people about some of your backstory and also share with us your exciting new position at Seattle Children's?
Yeah. Thank you for having me back. I'm very excited. Yeah. So Ann Moon, and I first came into the celiac world with my daughter when she was diagnosed, and that was years ago. That trajectory put me on just learning a lot and then translating that into my private practice where I was helping people navigate just that transition into gluten-free. And it also brought me to work with the celiac program back in 2017 at this point, doing some fundraising and work with Dr. Lee's program that he had just started. And then that kind of snowballed into, through COVID, we developed an advisory program and a guild. And so we've just been working really hard. And now I'm formally been hired onto the program, and I'm the celiac disease program manager within the hospital. So yeah, we're very lucky to have her.
Excellent. And when we talked to you and Dr. Lee about some of the support Seattle Children's has in place for patients and families, can you remind us about some of those and let us know too if there's any changes that have taken place since last time we talked to you?
Yeah. So when he first started the program, it was really because he noticed that the diagnostic care was important, but then the families really needed more holistic and, supportive care after the diagnoses. And so he really just started to bring on dietitians who understood the disease and navigating how to do that. And then that snowballed and grew into, well, there's the social emotional part. And then he realized that, and we all saw how kids just didn't know other kids with celiac disease. And whether that be not being shared at school because of HIPAA reasons and also the privateness of the disease and also just kind of the isolation that it kind of breeds. So it's like, oh, let's get these kids together and show them that they're not alone. And let's get these caregivers together and show them that they're not alone and really provide that experience of community. And so in-person events have grown. We're doing more educational webinars. We just had a cookie exchange where a bunch of kids and families came together and they had baked at their house and they were brave to share and brave to try other baked goods from other people's houses. And, it's just things like that that really just make a big difference. And so the program has been doing that and growing. And now that we're really fully out of all that pandemic and separation, it's just like, okay, what else can we do? And let's get this youth involved. And what are the other programs across the country doing? How can we bridge the gap between programs and how do we work together so that no one has to reinvent the wheel and maybe even go so far as to reach out into the general community and improve restaurant experience? And, we have a lot of plans. So that kind of stuff.
That's fantastic. We love how it seems like under Dr. Lee and now you, Dr. Rompca, that there's such this awareness, and obviously Anne, you being a parent of someone with celiac, that trying to connect all these things together and make the world better for these children living with it and obviously their families. My next question, I'll start with you, Dr. Rompca, and I'm sure, Anne, you have something to add to this, and I know there's not one clear answer for this, but what do you think the biggest challenges that a family is faced with when a child gets newly diagnosed with celiac disease? And maybe you can also give some insights on like how you handle that family when a child deals with that diagnosis. I know personally it can be overwhelming. You're, getting this diagnosis. We talk to so many people, unfortunately, based on where they are in the country, that are just sort of sent on their way and told to go gluten-free. We know that's not the case at Seattle Children's. So what is the biggest challenge, and then how are you able to address some of those?
Yeah, no, that's a great question. And it's funny, in my intro, I forgot the most important part. I was diagnosed with celiac disease when I was 21. So I know I was sitting here, I'm like, when can I how did I just nervousness. And so I've been living with it for, over 15 years too. So I think that definitely adds to what I'm able to offer to families as well too. I'm very open about it in clinic, and I feel like families are very receptive of that. And it definitely helps navigate, 'cause as you know, there's so much nuance to this, right? Like you go in, you're like, okay, just don't eat gluten. You're like, that's barely the tip of the iceberg, right? And so I think the most challenging part is how overwhelming it is, and especially in that diagnosis period. And so I think that's the most challenging part for families. But I think what we have to offer, I sit there and I talk about it and everything that we have. And I try to, reassure families. I'm like, this is the whole reason I came to work here, is because the program that Dr. Lee has built is so amazing. Like our interview went over way too long because we were excited and had so many different ideas and things like that moving forward. And so I tried to provide that comfort to them too. Like, we have a lot going on. We have a big community here and we welcome everyone into it. And I think too, just everyone always comes with a very long list of questions, because once you start to live with it and do your research and everything, there's all those small, subtle things that you don't ever think about. And so I usually just, put my computer aside and I just say, let's just go through them. And we start with all the questions. And I think that's one of the most helpful things. And then review everything that we have to offer. And I think families really appreciate that. And then so there's not great guidelines on follow-up care for celiac disease. And like you said, a lot of people are sent on their way. I definitely was. And, in college, I had no idea what I was doing and it was so overwhelming, but we've established our own follow-up guidelines. And so we'll see kids every 3 months for a few visits and then space it out to every 6 and 12 months once they have met with the dietitian 1 or 2 times and our labs are starting to improve. But we've really standardized that in our celiac program. And I think that's also so important. We also are committed to getting patients in who come in with a referral for an elevated TTG or concern for celiac disease within 2 weeks, typically. So there's a lot of messaging and back work and adding on visits that Dr. Lee, myself, and Kyle Lewis, one of the advanced practice providers in our celiac program, work really hard to make sure that we're getting those families in a timely fashion so that they can either have their serology or endoscopic diagnosis.
That's great. And thank you for also sharing that you yourself have celiac. And it's funny, it's not funny, but I almost want to ask some of the professionals sometimes that we have on, because I think you both probably know most likely Dr. Maureen Leonard, who's frequently been on the podcast, and she herself has celiac. And I'm sure that not only informed your journey through med school, but your passion for helping others, just like we have that passion. So I think that's really great that you share that with your patients and their families, because I'm sure that's an added level of comfort where they can connect with you, that you're not just saying, go try this and do that. I also think of our friend, Dr. Ritu Verma, who doesn't have celiac herself, but has 2 children with celiac. So it's comforting to have you all out there who have this added knowledge of not only having great medical knowledge of it, but having to live through it yourself.
I couldn't agree more with what you're saying there too, Michael. I was thinking the same thing. I always am so excited and happy when I find out that somebody like yourself, Dr. Rompca, has celiac and is also like helping figure out the future for celiac. And then I just wanted to kind of jump over next. And I know, Anne, you had mentioned the cookie exchange as an example. And on the stress and anxiety side of things for the children and the kids, what other types of new treatment/support systems are available for kids being diagnosed with celiac disease?
I think that's really the area in development, because it is so nuanced and it's so difficult, because like there's factors of age of diagnosis, supportive family, are you a itty bitty person at 20 months like my daughter, or are you a rebellious teenager at 15 who is like, an asymptomatic teenager? That would be, one of the harder ones to navigate post-diagnosis. It's like, I feel fine. And but then there's the I feel different. I don't want to be highlighted, having to miss out on parties. You hear stories about kids not getting invited because the family doesn't know how to handle it. So this avoidance is easier than asking questions. And the emotional impact is big, like there's the initial and then just the ripple out effect. And so I really do see and think that the social work, mental health world is really kind of coming on board and identifying that, like, oh, some of this anxiety, some of this depression, some of this negative mental health outcomes really is stemming from what this day-to-day experience is like with this disease and condition, and how that, whether or not they're healed or not, like that causes an issue, and then just their life experience. And so we are working on really looking at the mental health stuff and bringing our mental health experts in to say, okay, developmentally, what could we maybe expect from a teenager getting a diagnosis, or a teenager living year 2, 3 out and trying to navigate going out to dinner with their friends? What is the anxiety of a caregiver like? There's lots of information about people, caregivers in other disease processes that like known that's hard to do. Well, what does that look like in here? And just trying to really relieve the anxiety and normalize it all and just identify it. And so we're trying to bring programming on that will support that. And so right now we're kind of like gathering our resources and like, okay, who has time for this? Who knows this? What can we do? What's the best way to provide this information for people? Is it webinars? Is it in person? Is it group dynamic? Is it one-on-one? What can we do? What does the program itself have bandwidth for? And we really want to improve that part, that mental health and that anxiety part, because it's huge and very, very nuanced.
Yeah. And I would say too, like once you're kind of established in your diagnosis and your pattern and you have your gluten-free foods and thing, and it becomes second nature, I feel like the anxiety is what permeates, right? And that's still left no matter what, and can be really tough over time. Other things that we do want to work on too is kind of, with all of the support programs that we provide, we want to make sure it's helping with that piece of things. And so eventually I envision doing like research in that aspect, like before and after, like how is this providing some portion of that to families? But then we also do have a new GI psychologist that is joining our department, fully ramping up, I think, next month. And I'm sure we'll be overwhelmed with all of the things that we need, but I do think it will be a good support, especially for those that we are finding are struggling and needing that support too. And then we do have a psychologist on our community advisory board as well too. And she did a recent webinar with another one of our board members on kind of navigating that anxiety for patients and for parents too.
Hey Cam, before we continue the podcast, I'd like to take a minute to talk about our sponsor, Taste Republic, who makes delicious, fresh, gluten-free pasta. A lot of times we'll get our family together and it's so wonderful to have Taste Republic because there is literally something for everyone. We have people who are gluten-free and dairy-free in the family. We have gluten-free vegetarians. We even have a couple gluten-free vegan folks that will show up. And we actually have some diners that are a little more finicky that don't really want to eat their vegetables and need a really tasty way to get them. And Taste Republic solves all those issues in the most delicious way. Isn't that right, Cam?
It's totally right. All of Taste Republic's pasta is gluten-free, offering distinct options tailored to organic, vegan, paleo, and high-protein preferences, some even providing vegetable servings per portion. Their range includes organic varieties, vegan options, and filled pastas made with brown rice and real Wisconsin cheese. The fan favorite cauliflower linguine shines as both grain-free and paleo-friendly.
And for a limited time, you can enjoy a special treat. Brie and cranberry tortelloni, as well as 3 cheese and potato tortelloni. You will receive 3 packages of each and can only get these unique combinations of their fresh pasta online at tasterepublic.com. The best part? Use the code Celiac Project to get 20% off your order. Supply is limited, so get them before they're gone.
Visit tasterepublic.com. Use code Celiac Project to save 20% off your online order and have delicious, fresh, gluten-free pasta shipped directly to your doorstep.
Now let's get back to the show.
Sounds good.
I love that you're taking all these different approaches. Cam, and I love that you have a psychologist with that as a focus. And I saw too that you're, in addition to these supports, am I right that you have a mentoring program starting up or started? Because I think that's a great thing. Personally, my daughter, who's now 17, mentored through Boston Children's Hospital, a younger person with celiac, and it was transformative, hopefully to the child that she was helping, but certainly I think even more to my daughter who got a new perspective. And she was actually the first person, my daughter was, that this girl got to know who had celiac, because nobody in her school was like open about it and everything. So I think having groups and then having mentors, and it's really exciting that you have all these different initiatives and things happening.
Yeah, it is very exciting because it can be so isolating. I didn't know anyone for years after I was diagnosed that had celiac disease. And now that I'm here, I feel like we're everywhere, you know? So it's like a whole different, I was thinking about that the other day. I'm like, how did I go so long without ever meeting anyone with celiac disease? But the mentoring program is really driven by our wonderful group of youth. We have our Celiac Youth Leadership Council. And so this year we have 22 children that are part of it. And so it's growing every year, which has been wonderful. We meet every month, and every year they pick a project or 2 to also work on. And this was completely driven by them and their need and what they want to see, and their desire to help, because they know exactly, what it's like to go through it, and they want to support their peers that are going through it. And so we're working on formalizing that process, and we do it informally right now, but we're working on kind of a more formal mechanism for it, and then tracking those metrics too. And so I think it's really exciting and really wonderful, especially how it was born, right? And so it's been wonderful to watch them grow and see their desire to help their peers too.
It's always amazing when I hear people are diagnosed and then they don't meet people, because I think maybe I have the magic touch. I was diagnosed and suddenly my best friend was dating someone and then she got diagnosed. It's maybe not the magic touch. It's the opposite of that. Maybe I just bring out the celiac in people. Anyway.
No, it's magic. It's my favorite. It's the best thing that's happened to me and completely changed my life trajectory. So I'm going to say magic touch.
I love that approach, and it's totally changed my life trajectory as well. So I will go with that. I love your optimism and upbeat view of having celiac. Shifting gears just a little bit, we love to have doctors on and ask, maybe this is a hard sort of open-ended question, but of the different treatments and possible medications coming down the pipeline, how do you feel about them? Are there any that have caught your eye? I'm sure it seems like sort of a golden age of celiac research. Any thoughts on any of them, or how you feel about those kind of treatments in general?
Yeah, well, I think I have a different like personal and then professional, right? Like there's my celiac hat and how they feel about it, and then professionally as well too. I think, there's over a dozen different medications that are under development from various different companies. And one of our board members works for one of these and recently gave us a talk and kind of updated us on the current status of them. What I overall took from that too is we have a lot of cool things under development that work in different processes in that immune cascade in the body. But we're definitely a ways away from finding anything to treat celiac disease or even minimizing, effects after cross contamination and things like that. So we're definitely a ways away too. So
And I know it tends to be when we talk to other doctors, it seems like a moving target. It's always
yes.
5 years.
5 years.
Yeah.
Yeah. And yeah, I was going to say 5 years is generous. In my head, I immediately think like a decade just with how long it takes for drug development and things like that. And knowing, what has happened with some things that they've tried that didn't get out of, whichever phase and things like that. I think that I would even postulate a little bit longer than that too. So
Yeah. Thank you for being honest about that, because at times it feels like because we're reading so much and there's so many, as they say, shots on goal with all these different meds and types of meds. So I think it will be coming, but you sound more realistic about yours than others. So
Definitely. And you actually touched on this a little bit earlier. I just wanted to see if there was more to add. Working with the local restaurants and businesses to make eating safer for those in your community. Just wanted to know what ways that you were thinking about going about that.
Yeah, well, we're excited because we came up with, through our advisory board, we came up with a little educational, not a how to, because we're not in the place to say this protocol is exactly what needs to happen in this restaurant, but it's really just a guideline of this is why it's important to serve this community. And this is why the gluten-free request at a dining establishment should be taken seriously. Because, some people choose for preference and that's fine. But because of that, not all requests are taken seriously. And so it's really just to highlight what can be done within a kitchen, those protocols, but then also the why. And we were just at a restaurant a few weeks ago, and what we did is we brought a couple of our Silk team teenagers, and they came and they spoke to their positive experience and negative experience. And the restaurant team was just so receptive. I mean, we assumed it was going to be like a half an hour, 45-minute experience with them, and they had so many questions, the restaurant team themselves. It was really impressive because they really do want to safely serve people. I mean, no one's out to make anyone sick. And it was just so refreshing. And they spoke so well, the kids did. And maybe Dr. Rompca, you can speak a little more. You were there too.
yeah, no, it really was incredible. I left like feeling such like joy because of it too, right? Not only as someone with celiac disease, but a provider to kids, but then like just proud of the youth that came too, right? To be able to speak on something like that, which took me years. And even sometimes I still get a little clammy about, It's
Yeah.
but, they're so impressive. And it was amazing to see how engaged the staff was too. And so, yeah, it was a really wonderful experience. And then they were also kind enough to, get us whatever we wanted from the restaurant then as well afterwards. So we got to sit and enjoy and eat and everything too, which was a wonderful experience.
Yeah, that sounds so nice. I'm curious too, in the conversation, what did you guys think was the most standout or that you were surprised by either from the staff or the kids that they specifically said?
I think one thing is, I think what got the staff the most is when they understood, like, really, oh, what it actually means to have celiac disease, like what this is doing to your body. Because we had our dietitian give the talk about like what gluten is, what celiac disease is, and what it does to your body. And I think that is really when you kind of like saw them turn their engagement up even higher because I don't think, realize, right? And so it was really wonderful to see that and for them to respond in that way.
That's awesome.
I think what's helpful for us too is having that back and forth dialogue with them because we are not in the restaurant industry. What does it actually mean for them to provide safe gluten-free foods for the celiac population? I mean, like in my head, it's like, oh, it's not that challenging. You could just shift some things and, protocol. But, in the reality of it, the kitchens are busy. There's language barriers with staff. There's, high turnover. There's small kitchen space. There's all these different things. And so part of that dialogue too is not just our going into restaurants and saying this is what it is and why and how. It's like, what is it actually like on your end? Like, how can we help educate our community to communicate with you? Like, what communication tips is helpful for the staff to really understand what's happening, so that we can help our families walk into an establishment confidently and know that what they're saying is great from and understood from front of the house to back of the house to, then what to look for on the plate when it gets delivered, like. So it really is just really trying to open up that dialogue back and forth of this is what it's like for us. What's it like for you? How do we come together? Because we want our people to go dine and support restaurants, and we want restaurants to be able to support us and stay open,
Yeah, I applaud that you're doing something like this because we wouldn't usually think of that with the hospital doing that outreach. And you both alluded to this. I think that communication is such an important piece. I think we all go out, and I think it can be very sort of the experience black or white, where we kind of recoil if we get the deer in headlights or not the answers that we want. But I think by opening up some of the real dialogue, and I love that you'd had this like planned thing where it wasn't like you're just showing up and then those are when the problems happen. So that you had this open dialogue and that the restaurant started to understand what was needed and you got the perspective, because we often say it's always sad to us when the places that do gluten-free so well don't make it, and we all want to be shouting out about those places. Or Cam recently was on a trip and they converted the dedicated fryer to not dedicated anymore. And you just, we hate those stories because we think, oh, these places are getting it. And when they move backwards, it's that much, harder to sort of process and take in. But it's great that you're doing things like that. Really excited about all the work you're doing. And I know we're getting near the end of our time together. Anything that we haven't hit on today? I'm sure there's a lot that you think would be helpful for our listeners to hear today.
Yeah, and I think, do you want to talk a little bit more about the Guild and the 5K and kind of update from that perspective? I think it's always good to have that update, especially with how much it's growing since the last time that you guys are on.
Yes. Yeah, that is amazing. Our Running from Gluten event, we're getting into our 6th year, and the Guild has really grown this event. It's gone from the first year was virtual, and then we just had a few hundred people. And then this past May, we had more than 600 people, closer to 700. And we had Fran's Bakery, they brought in their grilled cheese truck. And so they gave out gluten-free grilled cheese to everyone. We had bakeries, we had the foundation, we had Gig there. And it's really turning into this little mini expo, which we used to have a GF expo in Seattle, but it is no longer. And everyone actually really misses that. And so not only have we really grown the participants in terms of who's running, but we're growing the people who want to come and support our community. And so the businesses are just stepping up, and a lot are donating stuff for the swag bags, but they're also showing up in person with booths, and they're wanting to meet people. And it's turned into this really great event. And, we have these dreams now of, well, we're maybe going to outgrow the space we've been at, and let's see how many more vendors we can get. Let's really just support and highlight the businesses that do it really well and welcome them in to provide their food and wares, and then just bring in more people and hopefully just get more support on a national level from producers and just people if they want to come to Seattle. I know Seattle's a great spot to be in, and May's not too bad. It's a great run. But yeah, it's just been really great to see the kids run, and we hand them the past couple of years. They've got medals that we've have for them, and they're just running around the park, and they just are so thrilled, and they can really just step into an environment where everyone there, between family, friends, medical, food producers, organizations, they're all on their side, and they all want them to have a great time. And it's just such a fun event. And I'm just so proud of the Guild and what they're able to do. And our sponsors and our donors are just so great.
It's wonderful. And also, guys, gluten-free grilled cheese. I had so many of them. I was like shoving them in my pocket.
They ran out.
And I'm getting them for other people when they're really it was so good.
That's so funny.
Yeah. And the other part too is I really want to, like, we're really trying to put an emphasis. Obviously, we have the clinical work and the program from that aspect through the hospital and everything, but we're really trying to like shift our emphasis to what can we do to expand our involvement and engagement of the community, and how not just with the families, but education for businesses and things like that, expanding our support funds and those types of things. But we want kids to not only live with celiac disease, but we want to thrive. Because like I said, this is like one of the best things that has happened to me and has had such a positive trajectory on my life that I want them to feel that from it too. And I think that we really have that opportunity through our program to provide that experience for them. And it just makes me really excited.
I think it's also really important to note where some of the funds go that we're raising with this event, but just in general, the program funds. Living gluten-free and with celiac disease is very expensive, and it's especially now really challenging. We have a monthly stipend program where families can apply, and we will send out $100 a month just to offset whatever costs they have. They can use it however they see fit. We have a holiday fund so that a family can apply for it once a year, and they get, a $100 gift card to help support whatever celebration they want to do, whether it be a graduation party, a holiday thing, a birthday party, anything. You can apply for that. And we're also working with the foundation and their 6-month food and equity program. And we're really just wanting to use our money to help people follow through on the only treatment plan that they have, which is food. When there's no medicine, we really just need to make sure people can eat consistently gluten-free. And however that support looks, we just need to make sure that people have access. So
I think that's a great place to end today. The positivity from you, Dr. Rompca, and you, Ann, and explaining this is such an important need to make sure people are eating and getting gluten-free food. It's a hard time. Price is going up. So it's great that you have those supports, and really just so wonderful talking to you both today. Thank you so much for joining us.
Thank you so much for having us. This was wonderful.
Thank you.
It was great.
Thank you. Thanks for listening to today's show. If you like the podcast, please consider leaving us a 5-star review on Spotify, iTunes, or wherever you listen to the podcast. This will help other people find the show. Thanks so much, and we'll see you next time.
See ya.